All right, so the first thing I need to do is tell everyone they're being recorded, apparently, according to this policy. So welcome to the recording of Journal Club at the Institute for Evidence-Based Healthcare for 19th of February 2026. I'm Justin. I'll be running the Journal Club or facilitating the Journal Club, and there's a few people here. I'll just stop that. So this is going to be a bit different to maybe a normal Journal Club, that it's actually preprint club this time. Part of why I wanted to talk about this one is because I know that there is a lot of aggressive marketing and sales people out there around AI and research. And I thought this was a good time to talk about whether you should trust them or not. And I also know these guys directly have actually reached out to people here at the Institute to try to get them to subscribe to the tool. So this is a bit of a discussion point about this. So I'll be talking about, I'm going to be going through the preprint automation of systematic reviews of the large language model, which was put out and is about the AutoSR tool that's currently available. So this preprint was, I think it's been around for a while. I reviewed it last year sometime, but I thought it was still quite relevant to talk about here. And it's probably the best example I could find. Also, because I'd already done it, it was also very good work for me to do it again. That's a point I say another reason.
Yeah, and I also just because I used the link on MedRx,
Yeah.
review, whatever it's called, and the latest version was released yesterday.
Oh,
Of the pre.
Wow.
Yeah, apparently.
All right, well, that is very interesting.
it's new current version.
So yeah, if you press new current version,
Postage.
The red.
yeah, if you click on that, it's February 18th. This is
All
hard.
right.
Press, guys.
Hang on. I'm reading the old one. Sorry.
I'm sure it's probably not changed.
This is I think this is the third time they've done it.
Oh, okay.
I think if they do it, this one is a bit different actually. That's not the PDF.
Yeah, that's very different.
Yeah.
Okay, all right.
All right. So I'm really glad that Ali pointed that out. No. I'm actually really glad. I know it's me, so I know that on sarcasm or irony, I know you can never tell. No, I'm really glad that Ali pointed that out because I can now fold that into my presentation, which actually was primarily about when a preprint comes out, can you trust it? And I mean, this is not a new publication. They've overwritten the old preprint, which is quite concerning to me because this is now, I guess the DOI now points to this one instead of the other one, which they put. But I guess part of this presentation was about how whether or not you can trust a preprint when it comes out. So we're going to go back to the old one that I'm doing, and I will actually have a look at this new one as well. Not today. The abstract's really different. I reckon that the rest of it won't be.
Do you reckon like they're preparing it to submit, and that's why I've got like a structured abstract now?
I think they might have heard what people were saying about them at
that
every
was not
place he
like
went
the
to.
previous version.
No, it's all.
Oh yes, you can probably share your screen on Teams, by the way. So.
Oh, sorry, Caitlin.
That's all right, thanks.
Instead of sharing you, I'll share the screen. Sorry. All right, sorry, so Ali was just saying that the brand new one just came out and they just overwrote the old preprint with the new preprint, which is actually not even up on their website. So their website directs you to the old preprint. They make all their claims.
Someone's lagging.
Yeah, so their own website is lagging. All right, so the new one looks like it may be not as bad as the one I'm about to talk about. Just put it that way. I'm not saying it's good because I've read it, but it's not as bad as this one. So I'm just going to talk through this one quite quickly. Caitlin, do you have a copy of the old one Ali sent? You sent the old one around, Ali?
Yeah.
Do you have a copy of the one Ali sent?
Yeah, I think so. Thank you.
Because I don't have that one to put up. I've printed out and I've scribbled notes on it. So I'm just going to talk through some of the interesting things, interesting claims in it. Then I've actually got a presentation that I'll go through quite quickly. And then I'm quite interested to then hear what people think about my opinions on preprints and the trustworthiness of preprints, which is kind of the point. I'm not talking about the trustworthiness of, well, I'm also going to talk about the trustworthiness of this tool. So the very first thing I think was really, really interesting is in the abstract. If you go about halfway down, it says using AutoSR, we reproduced and updated an entire issue of Cochrane reviews, so n equals 12, so 12 reviews in 2 days. This represents an approximately 12 work years of savings. So that's quite a substantial claim
Yeah, huge.
to make, that they did 12 years worth of work in 2 days. I'm pretty sure that claim is not in the new one. So that was what actually I think inspired a lot of interest in this paper. So when this preprint was published in June last year, I'm pretty sure, quite a few people got in touch with me and emailed it to me and said, what do you think of this? And I'll tell you what I thought of it a bit later. For 2 reasons. One, some of the claims in it are quite substantial in terms of workload saving, but also there are some famous names in the author byline. 2 of the really big ones, and I'm sure some of the other people are quite well known, but 2 that jump out is Isabella Boutron, who is a very famous systematic reviewer, but also sort of automation person, and David Mower, who I think came out of Prisma.
Yeah.
So that's also why this paper just jumped on so many people's, I don't know, whatever you call it, spectrum to radars. So basically these guys did 12 reviews in 2 days instead of 12 years. Or so they say. So then these findings demonstrate LLMs can autonomously conduct and update systematic reviews with superhuman performance, laying the foundation for automated, scalable, and reliable evidence synthesis. So when I read this, I made a couple of notes to myself, which is, did they actually write the update? Did they fill out a summary of findings table? Were there any excluded studies list provided? Was risk of bias done? And did they update the discussion? Which are all things you do in an update. So these are all the questions that popped into my mind as soon as I read that. You'll find out whether they did those things in a couple of minutes. There's an introduction. So through the introduction, in the abstract introduction, they say that their AutoSR tool is an end-to-end tool. So therefore it starts at the very start of systematic review, finishes at the very finish of the systematic review. Well, that's very exciting. Our Terra tool is actually end-to-end as well. So that's great, except I then came down at the very bottom of the page. So the bottom of page 1, the third paragraph in the introduction, it says, using AutoSR in under 2 days, AutoSR is designed to work alongside researchers requiring only a protocol, search results, and defined extraction variables. So it's not fully end-to-end at all. It is about 3/4. So that made me quite nervous. If You don't even optimize. Help optimizing searching will help design protocols, and if you call yourself end to end, basically think that you either don't understand what a systematic review is or you don't understand what end to end. All right, so then I'm going to jump over. Well, okay, it's actually over the next page, but they say it's end to end. So they tell you what it doesn't have before they tell you it's end to end. So I did make notes because it also doesn't do other stuff, basically. It's not end to end. It doesn't design searches. It doesn't do any writing for you. It doesn't do any risk bias for you. So it only does screening and data extraction. And screening and data extraction, other people do that. We do screening, Covenants does screening. Also, everyone does screening. So the only extra bit they got is data extraction. So that doesn't make it end to end. So there's a few other bits. And then numbers are okay, by the way. I mean, that was also another big thing. I'm going to talk a bit about not this one, but numbers with evaluating SRs set as well. So the number's not too bad. There's a couple of other points from this preprint, though, that I just want to mention. Is they talk about, well, they talk about how great it is, and they did 12 reviews in 2 days, of course. And then on page 4, one of the headings, so I'm jumping a lot, by the way, because you might have picked up on the fact that I'm not really a fan of this preprint. No, I don't want to read the whole thing. I have read the whole thing. Page 4, it says, for LLMs achieve state-of-the-art SR data extraction performance is their heading. And then they go down to talk about how amazing their data extraction is. And it looks like it gets quite a few things right, which is fine. But then if you jump over the page under number 5, agentic workflow of LLMs can rapidly reproduce, update, review. Buried deep in all of this text, they only actually looked at the very one primary outcome. So they only extracted one primary outcome. So again, I would not call being able to extract one primary outcome 85% at the time state-of-the-art data extraction. And I think I do have a workshop to cover some slide and cover some more of the detail here. I'm not going to go through the discussion because, you know, I will talk about their conclusion. In conclusion, our study marks a major advancement in the development of SR automation tools using AI. It's quite a big claim to make when, you know, you did all right. I wouldn't call it a major advancement. You did all right in data extracting, you did all right in screening. To be honest, your numbers weren't good enough for anyone to actually use them because their numbers are not 100% recall. Okay? They float around 85 to 97. So it actually excludes those. It's got a big workload saving. If you're happy to potentially miss 15% of your included studies, it'll save you some time. I've yet to meet a systematic reviewer who went, I'm willing to pay that price. Not here, maybe outside the institute in Russell. And then the last thing I'll mention before I'll jump into the actual slides is ethics declaration. Very page 1113, and then I'm going to stop. I'm not going to go through the supplementary material. So I thought it was quite interesting in the ethics declaration, there was no direct funding support for this manuscript. Okay, fine. Okay, fine. And then they also say no funding source had any role in the design of this study, its execution, analysis, interpretation of the data, or decision to submit results. Again, fine, except that RKA, so one of the lead authors, is employed at OpenAI and he owns stocks in OpenAI, and this is powered by OpenAI. So, I mean, if you own stocks, kind of feel to say no funding source had any role in the design of the study, you're basically employed by the guys model using.
And yeah, and several of them are the founders of.
Yeah, and have a huge stake in performing well. So, I mean, I guess technically there's no direct funding is probably right. But to say there's no direct funding and then say, but we own the company, I kind of feel you should not have no direct funding. Okay, that's right. I mean, I feel a bit unethical to say there's no direct funding support for this manuscript and then say, but we own the entire company.
Just say the other stuff, like just those things.
That's right.
You know what I mean? Like, you don't think that.
Don't. You shouldn't have it. Should be you know, the very first thing should be the three authors are founders of an equity in review. That should be the very first thing you say. Because then after that, it doesn't matter what you say. Anyway, I just thought that was really interesting because I'm guessing technically that is accurate, but extremely misleading in terms of stuff. So misleading, in fact, that when the lady from Nature wrote an article about it, I had to point out to her that the authors were actually so because she hadn't picked up on it, probably because she just read the very first line
Yeah.
and went, "Yeah, I know you should go down, but trust research." So that's the paper. Should you use AutoSR for LLM for doing your reviews? Well, but next I'm going to talk about a bit about evaluation. I don't think we've got time. It's not too late, is it?
No, 20 past.
Oh, good. So I'll probably be talking about 10 minutes through this presentation, and then the 5 of us can talk about whether we trust preprints anymore. Six of us can talk about preprints, which was kind of one of the points I was trying to make. Was just because someone pops a preprint out, maybe doesn't mean everyone should jump up and down and go amazing. So this is a presentation I did last year at Monash Uni. I got invited down for an EHT day or something. So it's only the interesting. I cut all the boring stuff out, so it's only the interesting. So this was where I started to first look at value. Well, it's not because we evaluate our own stuff at the time, but this was when I first started to look at the evaluations in systematic reviews by GenAI. So we did, as people probably know, we did a review here on does GenAI work to do systematic review. So it's weird that you do a systematic review to see if something works in systematic review. So we did this review. This was in April 2025. And in fact, one really interesting thing about this review is we spent a lot of time talking about whether we should include, because it's a fast-moving field, whether we should include preprints in our review. And it was a lot of people, half and half. Some people said yes, some people said no. Justin was on the no side. Fortunately, we went no, so we didn't include preprints. But there was this idea that because it's a fast-moving field, maybe we should. So I won't go through it because you guys know how to do a review, but basically, we did a good review. That's all that this stuff says. You'd have to, it wasn't rubbish. Here's some bit of method stuff about what we did, so you know. So then risk of bias. So this was the risk of bias we found across the reviews. So it was a bit better than I thought it would be. So review selection was really weak. Everyone kind of just did a couple of reviews and they had sitting in their drive. So no one really went out and found unpublished or published reviews. Reviews published by someone else, they just kind of got a couple of reviews. That was for the most part the data set. GenAI conduct actually was also not that good. A lot of the time they already knew what the GenAI should come out. Even if you kind of don't think that makes an impact because of the way your workflow works, it actually does make an impact. Oh, sorry, that slide's in twice. So this was all of our included studies. You don't have to look at the data precision numbers. That's on purpose. Because I've been asked that every time I get asked that question. So let's start with that. We'll look at the numbers in a second separately. But basically, we included 19 studies. So those 19 studies, because sometimes there's more than one evaluation or different test. So it basically has 36 tests in 19 studies. So they did some of them had like 5 or 6 different variable tests. So out of those 36 tests that they did, 3 of them show that GenAI might actually work. One of these I think I'll talk about in a second. 8, probably if you paired it with a human to make sure the human was reviewing everything it did, 8 out of the 36 showed that Gen AI might help or might be all right. And obviously then the rest, 25 out of 36 clearly showed Gen AI sucks and you shouldn't use it to do this task yet. So I mean, that was always going to be true. But when we published this, Gen AI was terrible, pretty much all the time. So the top one is searching. So you can see for searching, I don't think that's changed. It's just awful. The next one's screening. So even for site screening, most of the time it actually didn't do very well at all. There's a bit of data extraction and risk of bias where it did it. But this is one of the studies that showed that it did quite well at screening because they averaged, as you should, yes, you average your numbers across all around your reviews. So they did 6 reviews. So there were 6 reviews in their sample. On average, it did pretty well. But these 4 reviews, so the 4 reviews where there's 2 green circles, actually those are the ones where it did quite well. And it meant that these reviews you probably could do with their tool, although 78.2% is probably a bit low. But I gave it a circle because I was being nice. But it was actually, you have a look, there's only one single one with 100% safety. Okay? So really there's only one where you could use it. But on the whole, it did pretty well across 4 reviews out of 6. But these 2 reviews, those numbers are really bad. So there's 2 reviews out of 6 where in fact it would have ruined the review, giving it one conclusion because it was excluding so much stuff. So in fact, it only worked 2/3 of the time. So on average it looks good, but in fact, 1 out of every 3 reviews is just going to be this one because it's excluded so much stuff. So in fact, their correct review answer rate would be 66%, not the 97-ish or 95% that their average has got. It actually only works 2 out of every 3. And if people don't like the fact that 95% of the time, it excludes 5% of the wrong stuff that it shouldn't, we said, well, out of every 3 reviews you do, one of them is just going to be completely wrong. I don't know. It's really, some people might be willing to risk it. 1 in 3 shot. Because that's already high enough. I mean, anyway, design concerns. So there are also design concerns across a lot of these studies around how they actually evaluated and reported, which will lead to the point that I'll end up making. They actually only reported processing time. So upload a PDF, get the PDF back. They did not put in the prompt design that went into it, developing the R code to get it working, the iterative, and most of the time they had like huge cycles of iterative prompting, trying to get a prompt that would work. Most of them just reported upload, download without all of the substantial work that goes on beforehand. I think there was only one which actually put in like 2 or 3 days extra time required to set up and get the prompts working. Which then leads to this point. So this was very, very common across most of the studies. Shows promise potential. So shows promise potential means it doesn't work, but gee, I would love it if you help fund it so I could prove it doesn't work some more, to get more funding so I can prove maybe it will work eventually. So shows promise potential is always a giant red flag. Also, they tended to report quite often just on the good results. So they say we correctly included 90% of relevant studies, sometimes without saying incorrectly included 70% of irrelevant studies. So, I mean, yes, what I mean is, so they got 9 out of every 10 relevant study in, but they also included 70% of the experts. So, I mean, yes, you've got a 90% inclusion rate, but if you just include everything, you'll get 100%. Right, and so that was only a 30% workload saving. So, and quite often they didn't make that distinction and report that. They only talked about the 90% include. Say, if you include everything, you get 100%. So I could go down there right here called Justin. get you 100%. Your workload savings 0. So, but I could also, it's very easy the way you report and talk about your results influences a lot. And again, but that was not a small thing. That was a very common thing in those papers. So when we submitted this for review, it came back, great comments from the reviewers, all of them, even reviewer 2, which is unlikely, but great comments from everyone, which really helped us kind of improve it and tighten it right up. But this was a very interesting comment. They said, thank you for submitting this China review. Useful, interesting. Currently, there seems to be almost a developing culture of overestimating LLM performance in research, which we agree basically that it was quite astounding how many of them were overstating. So this is a quote from one of the papers to kind of outline this idea about how they reported and how they overemphasized things that were good, even if they were pretty irrelevant. So this is a real, I didn't make this up. So 12,870 studies were provided by ChatGPT. So this, I think, for the screening. So the first thing is 7 were perfectly eligible. Okay, so 0.5%. So ChatGPT found a bunch of papers, only 0.5% of them were actually perfectly eligible. But 1.4% could be considered suitable on the assumption they were real. So basically, it made up, what's that, 0.9%. So it made up 18 studies that met the eligibility criteria, but they just were not real. But these guys frame it like studies were, ChatGPT did great and it would have done a much better job if only these studies were real. They don't say, it was terrible and it included a bunch of fake evidence. They frame it so it sounds like it did well at something that's actually very so. And then finally, if only they're real studies, it would be great. But the really interesting thing is that right at the bottom, they then say, but among these, only one study was perfectly consistent with the studies finally included in the review they used as a test. So in fact, when they say only 7 were perfectly eligible, that was the 7 ones that they considered eligible by some criteria they had. That kind of matched to the original review. Not actually what they should have done, which is said they're eligible if they were in review, not if they met like a couple of benchmarking things. So they say that 7 were eligible, but really, in the end, it only got 1 right out of 1,207, which actually is not very good. So that was kind of what we found when we did our review around them talking about the evidence, massive overstatements and massive framing things that are like negatives into positives. So this is from the Elicit. So Elicit is a company that actually says they can do reviews in like 5 seconds as well. So 50 to 80% faster and cheaper. Actually use the quotes from their website. So this is from the Elicit website. This has been replaced and they've updated this. Maybe again, because I went around the world talking about it. But you can see, like they make a lot of claims. This is the front page of their website. I don't buried in some sort of strange. This is like what you first see. Automate without sacrificing accuracy. In comparison, business data extraction was 13 to 20% higher than manual extraction by trained research staff, 50 to 80% faster and cheaper. Update legal reviews. So, I mean, these are all very quite astounding claims, right? You might notice there's not a single asterisk or 1, 2, or 3, which then puts you and can go read the paper. Proves what it says true. And I looked quite a lot because I can't remember I did this first. I talked about this first maybe when I was at the Cochrane conference. So you can imagine just before I get up and badmouth someone, I was very careful. Nothing. There's nothing. You can't go and find the evidence. Claims. Saying that they have now updated their website. So you can see 5 Elicit users save up to 5 hours per week. So it's not as bad. 50% extraction details from papers, 50% stuff done across manually. And now they actually do have 1s and 2s. So they do have 2 papers you can look at. So this is a survey. So I kind of feel that's a big claim. I mean, make a claim because of survey. It's 10% of respondents. I mean, sure, but kind of it's not exactly the highest level. I don't know where surveys sit in the evidence pyramid. but I wouldn't use a survey as one of the, this is again the front page of their website. And then the second one is in pilot projects. Again, 50% time saving claims. That's a huge claim. I would want more than just pilot projects before I would put that on the front page. And as you said, like this is actually there. There's no caveats, right? Nothing says, you know, these are cautious numbers. It is stated as fact. But the fact it's just a survey and just a couple of people. So they did improve slightly, but really. So then on to this one. Claims are still being exaggerated. So this article is a preprint, it's not been pre-reviewed. What does this mean? Hopefully everyone knows what it means. I didn't write that, that's in the preprint. So I just noticed the name. I actually thought that was a note I'd written for myself, then realised no, that's not. What does that mean? So this got sent to me. This got sent to me by a couple of people, and I read it. I skimmed through it in 10 minutes, and after a quick 10-minute skim, this is actually what I thought. So the preprint looks pretty good. It may well end up taking over the world of systematic reviews. I would now think that this means anyone trying to get into the market is got no chance, and everyone already in the market, like Covenants is still up, are probably stuffed and are going to lose their market share to this new tool. I'm going to have to find some time and test it out and see how easy it is to use. So I was also quite amazed and blown away by this preprint. So I saw it again, probably because I saw this about me trying that time. And that way. I then read it properly, a bit of critical thinking. Some of the critical thinking skills I've learned here. So after a proper assessment of the paper, I actually asked for access. I couldn't get access to it. I couldn't test it. So I couldn't actually see what it was like, if it actually worked. And then this article, I got the lady who wrote about it in Nature. I got some quotes from myself and my good friend, James Thomas. So this is what Cow says, who's the lead author. It's crazy to see that. So he said this, direct quote is reported from Nature about his tool. It's crazy to see that the time I get a coffee, a systematic review will be done, which is, I don't know, I would say that to anyone about a tool that can't do that. And then he and his two collaborators started a spin-off company to turn their methods into commercial software platform. I mean, so again, especially if I was actually going to make money. So it's not like me and Tara, where really I don't make money. Tara is actually all the money goes to the uni. It's all governed by that. These guys actually, the three guys own this. They will make money. So you should be very cautious what they say. Then, so this is what my friend James Thomas, very famous automation system reviewer, for a scientific paper, it claims his claims need to be verifiable, and I can't verify. So in other words, he can trust it. Then there's this field is awash with hyping claims from companies. Now I did say that. I didn't think I'd end up in the HR, but anyway, there you go. So this preprint caused bars, but Clark, my excitement. It only does 2 of the big tasks of a, which I think I talked about. James says there's AI tools coming up all over the place. The real problem is that technology and tools are running ahead of the evidence, which is part of what this is all about, which is very, very true. So I think I kind of talked about this stuff. So this is just stuff I pulled out because I didn't read through the paper beforehand when I presented this. But again, end to end, which is not true. 2 days to do update 12 reviews again, it's just not true. So update and review does not take a year to begin with. It's not doing a full review from start to finish. So actually, I think they think it's 12 work years. So they did 1 year to update 1 review, which so it doesn't do any of this stuff. It doesn't update summary findings, doesn't do methods, doesn't update risk of bias, doesn't update your results, doesn't redo your discussion, doesn't fill out your, whatever it is, the excluded studies forms, all that stuff that gets done. So I've gone and had a look at them today to see where they're at today, to see if they're any better. So they did publish something. So this is actually the front page of their website today. Systematic reviews in hours, comma, not months. So they're still making that claim on their website. OSR performs evidence synthesis from thousands of citations written in human performance. Humans are looped at every step, peer-reviewed in Annals of Internal Medicine. So, just looking at that, and the published something, I wrote that, by the way. So that is, they have published something. Oop. So this is their stuff here. I mean, reading that, I would think they have now published a paper in Annals of Internal Medicine to say that they can do systematic evidence in Annals. So that's kind of what I would take from that, the way it's presented. Shall we find out if that's true or not? Oh, actually, I haven't even had time to include it because I included it. So what we're going to do is go live. Believe it or not. Annals, so this is their Annals of Internal Medicine. So it's not, we did reviews in hours instead of months. So they talk about developing their prompt templates for large language. It is published in Annals of Internal Medicine. That's true. That bit they got right. And then I'm going to go down. So it's just their, I don't want to say just, it's their screening tool. It's the performance of their screening tool.
And like how you write the prompt to put it.
We don't have access to Annals, and so I only saw this today. So I haven't had a chance to read it. But it's, I'm guessing they talk a bit about their prompt engineering, prompts into it. But it's their title, it's their title abstract and full text screening, which I still don't understand how this equates to doing reviews in hours, like years, because the screening performance isn't even that good. It's that age. So they have weighted, I couldn't find out what a weighted sensitivity is, but their sensitivity is range is 86% to 100. So I don't know, you sit there in the middle. I don't, anyone who says weighted sensitivity, I don't trust these guys. So I don't know what that means. But if the range is 86 to 100, I'd say they're getting what, about 93% include rate, around the 93% mark. So 7% of their stuff is getting excluded out. So you can't use that to update a review unless it's 100% all the time. It's really pointless. Full text, it wasn't, also was not too bad at full text, but, and I wish I'd had a chance, to read it. So I wish I'd changed this 2 days ago and I've had a chance to get the article. But these are the performance for their optimized. So at that point, I know what an optimized prompt is. I'm guessing that's where they tested and retested a lot against the standard set. If you have a look at their zero-shot performance, so that is where you just upload some stuff. So you guys might have used the Mecha screening tool here. That is just where you upload your studies, put in your PICO criteria, and go. Just kind of what you want in the screening tool. So this is that's a zero-shot performance. It's like 49% on both. So 51% of the time, it's excluding studies. So that's terrible. I'd be embarrassed if my tool was getting it. Admittedly, I have content to design our tools, so these guys don't have content to do the magic weapon. But like that's really not very good. And then they talk about single geometric screening takes to 83 hours. Yes, which costs you about that, which looks about probably right. Whereas their LLM-based approach did it in under 1 day. Now, I'm guessing, again, that's probably processing time, not optimizing prompt time. But I could be wrong. But the zero shot is so bad that I wouldn't care if it costs, I wouldn't care if they paid me $157 US. I would still would not use this tool. Not with numbers like that. So their limitation, further prompt optimization may exist. It's a retrospective study and it's a convenient sample. So that's a lot of reds in the risk of bias for this study. Full text screen evaluation into free PubMed Central. So again, it only works for PubMed articles. Maybe it doesn't read Web of Science, maybe it doesn't do very well with Embase because of the way they're structured, I don't know. And our prompting innovations may have a value to SR investigators. So that's actually a conclusion is not too bad. But it didn't achieve high sensitivity. So generic prompt. So it actually was not a generic prompt. It's an optimized prompt. Achieved high sensitivity and specificity. I'm guessing their generic prompt is their zero shot prompt. So that actually was not very good. So I guess the point again is systematic reviews now is not months, published in Annals of Internal Medicine, that extremely misleading front page. So then I'll just wrap up my little presentation.
Oh, I found it.
Did you?
I found the paper.
You steal access to it from there?
No, I just went through the library and linked some things. Would you
They
like?
have Annals of Internal Medicine. Could you send it to me just in case Ali's got super secret friend of the library access?
All the PDF.
Just the PDF still, not the link, because in case the library might. But yeah, if you can send me the PDF, that would be really good. Because I would like to read it, because I haven't had a chance to read it. You know, from previous experience with these guys, I don't trust too much what they say, but it was just more the misleading front page of their website. So then I'm just going to finish with evaluation importance. So this is my example I love using all the time. Again, I use this at every conference I go to around, like quite high profile international conferences. So this is luckily my good friend Farad Chopra, very quite a famous information specialist. Now PhD, he's going, I don't know, research fellow in something at Oxford. Anyway, so a deduplication study got published, comparing a bunch of deduplication tools. This is a little while ago now. You know, the tools were Rayan, Covadence, EndNote, Reduplic, and our tool. So he said, this one's good, this one's bad. And he said, we waited so long for this, comparing the performance of all of these tools, because it had been the first one that he compared them. And then Rayan came back with, you might be able to guess, Rayan didn't do very well. Rayan came back with, you've waited so long, it's already far out of date. Learn the latest by watching this 3-minute intro into Rayan's newest deduplication tools.
Are they social media?
Apparently. So Farad replied with, thank you for the video, but we need to rely on peer-reviewed, independently conducted and published comparative evidence to guide us in choosing. And I saw that, I still smile response every time. And I guess I'd just like to finish, and I think the main point here is, we all do this sort of evaluations stuff, and we all talk about stuff, and we all try to get evidence to support stuff. My advice is be the published comparative evidence, don't be the video. That's it. Done. I'll stop sharing and then stop recording. Hang on. And I'll stop yelling. Okay, I'm still here, so I'll keep yelling. Sorry, Carl, I also don't normally yell like this around the table. It's just you're here, and I know it's a bit hard to, sometimes it doesn't project very well.
That's all right. Thanks for thinking of me.
I'm still looking for the stop recording.